This is a comment on one of my videos on the Fleur-de-Lis Abdominoplasty video. I had a Fleur-de-Lis Abdominoplasty 3 weeks ago. 1 week post-surgery, the area around my belly button had to be reopened due to an infection. With pus draining from the belly button, I was hospitalized and required 10 days of IV antibiotics. I have lost 100 kilograms and I'm still experiencing some seroma fluid near the belly button after drains were removed on day 5. I currently have a passive drain in place which will be removed tomorrow as the seroma fluid had been decreasing. Given my situation, how long should I expect recovery to take after the Fleur-de-Lis Abdominoplasty? Thank you for your helpful videos. Okay, so here are the key points from the question that we'll be discussing this video. So we have obviously quite a few points in this video to go through. It is a big operation, the Fleur-de-Lis. If you've lost 100 kilos, is obviously going to have a significant amount of loose skin after the surgery. So we're going to look at the key points from this question. So first of all, it's a Fleur-de-Lis abdominoplasty 3 weeks post-surgery. Fleur-de-Lis is the one that we take the skin in the middle and down the bottom of the abdomen as well. It's quite a common operation that I do for post-weight loss patients. It is a big operation, so a lot of incision, a lot of space there, very, very high rate of wound breakdowns and issues. So the first week after the surgery had pus coming out of the belly button. So that was a wound infection that happened in the wound and probably in the cavity inside where you've been cut in the middle. There's been an infection. Now that's not uncommon. Obviously the first thing we do is antibiotics. If that doesn't work, we have to reopen the incision, wash the incision out, get rid of all that infection there. I find that the post-weight loss patients, because of the skin quality and also because of the big space that we create when we do the operation, it is not an uncommon thing to get infections. Superficial infections are fairly common. Deeper ones are not as common but do happen. I would say probably the rate is 1 to 2% of the operation. So 1 in 100 patients will have it. Going back to surgery and washing it out is certainly very important. IV antibiotics are essential then in that process. We would take samples of the pus, do swabs, find out what bug is causing the problem, and then basically keep you in to manage that. And that is why I tell all my post-weight loss patients, or pretty much all patients that have surgeries, that private insurance is really, really important, because the rates of having these type of complications is probably between 1 to 5%. So you're going to then have to go back to hospital, have further surgery, be IV antibiotics, and that's going to cost quite a bit of money if you don't have private insurance. So it's always ideal to expect those things to happen and be prepared for those things. If we get on top of the infection early, then usually it's managed quite well and you recover quite well. So the other point with this patient is that their post-weight loss, 100 kilos is a lot, and I see a lot of these patients as well. So with 100 kilo of weight loss, you've expanded your skin a lot when you had a lot of weight on. Then that's come down, so it's going to be a lot of thin skin, stretch marks, a significant amount of skin that we remove during an operation such as a Fleur-de-Lis. There's probably other skin in other areas as well, so that it means that it's a high risk operation from that point of view. Seroma fluid. Seroma still coming out near the belly button where the drain was removed. Now, what is a seroma? Anytime we cut the body, you get a space. The body doesn't like spaces, so it wants to fill it up with fluid. So you get fluid into the space, and if the body doesn't get rid of the fluid, then you end up with a fluid collection or a seroma. You get sort of yellowish serous fluid coming out of that wound. With drains, I usually leave them in until there's less than 20 cc's in 24 hours in the drain, and then we take them out. But even when we do that and there's nothing coming out, you can still get a seroma afterwards. The management of the seroma is usually to open up the wound, wash it out, and put a new drains in. Sometimes if you have a hole and the seroma is coming out, you actually already draining the seroma, so you may not need to just go back to theater and take new drains in. You can just have a passive drain. What I've been using sometimes is with colostomy bags, so they're actually the same bags that you use when you have bowel surgery and you have a colostomy. You put that colostomy bag on that hole that produces the seroma, and then the fluid will come out and the bag will collect that rather than go into dressings and your clothes and things like that. So that makes it a little bit easier to manage. Generally, I find that if you have a seroma that is producing quite a bit of fluid, you're probably going to have about 2 weeks, or 10 days to 2 weeks of having that dry up, because it takes time for the body to shrink that cavity down and then basically stop the fluid from being produced. As long as there's a cavity there, the body's going to constantly be producing that fluid and that's going to be coming out. So usually about 10 days, 2 weeks, it should resolve those issues. Worst case, again, you have to go back to surgery and just get that washed out, put a new drain in, and then manage that. When you get these complications, then they take a while for it to heal. So if you get a collection or pus or infection, that usually does take a week or two to resolve or heal up or be treated properly. Same with a significant seroma, that takes a week or two. So you're looking at probably the recovery period is going to be at least 2 or 3 weeks longer than the usual recovery period. So I usually say, once you get those problems, they usually happen in the week 1 or 2 of your recovery. That's going to delay your recovery to about 4 to 5 weeks after surgery. Again, with big operations like Fleur-de-Lis, body lift, abdominoplasties, especially if you had a massive weight loss like 100 kilos, you can expect these problems, and they're very common. If they're managed appropriately and you have a good surgeon that manages these for you actively, they should resolve within about 2 weeks, and you get back to hospital, you get your IVs, you get your drains, all that sort of things happening, and they should hopefully be resolved within about 2 or 3 weeks. So hope this is helpful. It is unfortunate that these things happen, but it is part of the accepting that you're going to have a big operation. So ask me a question, comment down below. I'll see you in the next video.